Jonathan, I'm 25 years old and I'm in my last year of medicine. And it's for an internship that I came here to Nepal.
I'm Jasper and I'm a colleague with the program, also my last year, also for general practitioner.
And I'm Caroline and also the same. I'm 24, not 25. So. Yeah.
We usually meet Damu, our host at the house, who's also our coordination at the hospital.
He's a really great host, he's really friendly and he's always good mood. Yeah,
Gives us always great advice, but that's the same for VSN.
Yeah.
They give us also good advice.
He's very sociable, very giving also. We always check who wants to do what, who wants to see what, and then we discuss who wants to go where. And get a day planning, and then we'll split up. A few go to the operation theater, a few go to the outpatient clinic.
We can do a lot of things in the hospital. We can follow with the physiotherapist. We can look in the operation theater at the operations. We can see how the lab works. We can see how the protheses are made.
We start at 8:30. Tea time, work, lunch, work, tea time. Today we finished at 3:30 for in the afternoon, something like that.
For example, this morning we followed with a physiotherapist, and we could help with casting a leg of a child with a very severe syndrome, and then we can also examine the outpatients.
And the others went to the wardroom first.
Yeah.
And then they get an explanation about the diseases, and then they go to the outpatient clinic.
The great difference with the hospital in Belgium is the pathology. Things like clubfoots and cerebral palsies and Larsen syndrome. We will never see that in Belgium, so if there is one opportunity to see it, it's now.
Next to the patients, there's also a big cultural difference. Like in Belgium, it's working as much as possible and as fast as possible, as efficient as possible. And there's like a hierarchy. It's like a pyramid. And here it feels more horizontally. Like you see doctors calling the nurses big sister or big brother, and then everyone is walking into each other, and everyone eats together, drinks together, have tea time together, and there's not a big difference.
We did health checkups by the child in the schools, and we listened to their hearts and their lungs and do an eye test. It was also really interesting for us because we choose the specialty of GP. It's like a basic doctor, so it was really nice to do and a great experience.
We checked things that we would also check in Belgium in school examinations, like the eyes and the weight and the length, and if they have any dangerous complaints.
It's totally different experience because I've never been out of Europe, so it's like a really different culture than I'm used to, so that's very interesting.